Well, why we want to think about screening for pancreas cancer is that unfortunately it's a serious illness. That we know that 8,000 people died of pancreas cancer in the UK last year. We also know that partly because of the way the disease progresses, it often presents late. 80% of people with pancreas cancer present at a stage which is more difficult to treat, and approximately half present to the accident and emergency department, again with more advanced disease. Because of all of this, it's quite satisfying to think about how we might screen for pancreas cancer. Unfortunately, screening for pancreas cancer does not have there is no national program in the UK, or indeed most of European countries. It's more, at the moment, it's predominantly used in patients who are particularly high risk for pancreatic cancer. Most people with pancreas cancer do not have a family history, perhaps only 10% do, but especially patients who have more than one first degree, i.e. more than one directly linked family relative who've diagnosed with pancreas cancer. People who have genetic conditions such as Lynch syndrome, which increase their risk of pancreas cancer. People who have familial genetic conditions that mean that they get recurrent bouts of pancreatitis. These are the people who are at higher risk of pancreas cancer and should probably have a discussion with their healthcare provider about whether screening would be the appropriate test for them. So in summary, there is no national screening for pancreas cancer. That people at higher risk of pancreas cancer with multiple family members who've been diagnosed with pancreas cancer, who've been diagnosed at a young age with pancreas cancer, or have known genetic conditions which raise the risk of pancreas cancer, these are the people who should have a discussion with their healthcare provider, either GP or specialist, NHS or privately, to discuss about the pros and cons of screening. There's no one individual test for pancreas cancer. The main stays of diagnosis of pancreas cancer and pancreas cancer screening are imaging tests, and by this I mean a CT scan, which uses X-rays to look at the pancreas, an MRI scan, which uses MRI, so magnetic waves, to look at the pancreas, endoscopic procedures, particularly a procedure that I perform called endoscopic ultrasound, which has a very close look at the pancreas, allowing you to see the pancreas in fantastic detail and, if necessary, take biopsies or samples of the pancreas, and to a lesser degree, blood tests. The combination of exactly which of these is the best test for you in the diagnosis and in the screening of pancreas cancer depends on a combination of patient preference and exactly what your symptoms are, what other imaging tests you may have had done already, like ultrasounds have shown. So broadly, screening would result in is investigated with either CT scans, MRI scans, or endoscopic ultrasound, an endoscopy type test with a camera is placed down into the stomach. So a combination of these three, the exact which one you would choose would depend a bit on your conversation with your healthcare provider. These are all the mainstays of pancreas cancer screening. There's a number of research studies going on at the moment to see if we can use screening tests in the form of blood tests, or a study which I'm involved in looking at urine, to see if we can show people at a higher risk of pancreas cancer. There isn't an individual single blood test that we can do that says yes or no to pancreas cancer, but there are tests commercially available at the moment which might suggest that you have a higher risk of pancreas cancer in collaboration with symptoms that you may have. And there is research studies going on looking at both blood and urine, which I'm involved in, to see if we can advance this and show test that can easily be available for the GP, for example, when you come to see the GP with non-specific or not clear symptoms to show that people are at higher risk of pancreas cancer. So not an individual blood test that can say yes or no for pancreas cancer. Blood tests can be used in cooperation with other scans and camera tests to try and diagnose pancreas cancer. And there's research ongoing at the moment to see if we can do more than that, but those tests are not yet commercially available. It's very important that when we talk about screening in the medical perspective, we're talking about speaking to patients who don't have any symptoms of an illness, but maybe at increased risk of the illness because of age or family history. If you have symptoms of pancreas cancer, then it's very important that regardless of your family history, you seek urgent medical attention. Broadly, the symptoms that can be compatible with a diagnosis of pancreas cancer are persistent abdominal pain or pain around your belly button that can radiate through to your back, weight loss or loss of appetite, yellowness of the skin or whites of the eyes that we call jaundice, persistent dyspepsia or discomfort in the abdomen. It's important to note that these symptoms are not specific for pancreas cancer. They can be quite generalized, and a number of people with these symptoms have another diagnosis, but these are the symptoms that we are concerned about might represent cancer. So certainly if you have any of these symptoms, then you should certainly seek a medical opinion to decide on what further investigations might be appropriate for you. There's not one individual test to make a diagnosis of pancreas cancer. Pancreas cancer diagnoses or investigations to rule in or rule out pancreas cancer are a combination of imaging. This is particularly CT scans and MRI scans. Endoscopic procedures, particularly a type of camera test called an endoscopic ultrasound, which is a camera test placed down into the stomach and using ultrasound waves to take a very close look at the pancreas. And to a lesser extent, blood tests, looking at levels of, for example, jaundice in the system and certain blood markers which can suggest that there's a higher risk of pancreas cancer. So to rule in or rule out pancreas cancer, imaging tests like CT or MRI, an endoscopic ultrasound test, a camera test down into the stomach to look at the pancreas and if necessary take a biopsy, and to a lesser extent blood tests. All of these in combination are used to rule in or rule out pancreas cancer.